All right, we'll go ahead and get started. Welcome, everyone. Thank you for coming. So, today is the first day of a series of 4 presentations. I'm going to be talking about how to navigate the medical system. It's a big topic, so we'll spend an hour each session. My name is Rafael Hasty. I'm one of the doctors up at the clinic. My specialty is internal medicine, and I do primary care here in Sublette County. So, to get started, I have a few goals I'd like to accomplish in this series. First of all, this is an overview of the adult medical system. In my practice, I only see adults, so that'll be the focus of this series. I would like to have people know and learn several pointers as far as how to reduce your need for the medical system. And then when medical care is needed, how to most ideally navigate that. So I do have a few disclaimers. As I mentioned before, the medical system is big, it's very complex. So this is by necessity a generalized overview. There will be some potentially upsetting or disturbing information that I will present, and that is simply just the nature of the beast. Sometimes the way things are can be disturbing. I will also like to point out that the information here does not constitute individualized medical advice, and I would encourage you to consult your medical provider if you have specific questions about your own health. Having said that, I will address many things that will apply to many people, so I'm hoping that will be useful. And lastly, this is, of course, one doctor's viewpoint. I do have references and have data to back up what I'll be saying, as well as my own experience. However, still one person's point of view. So just as with anything else, keep that in mind. We'll have time at the end for questions and answers if any arise. So just an overview for the next 4 weeks. Today, we will be talking about prevention and then having kind of a bird's eye view of major aspects of the medical system. And then the rest of the other 3 weeks, it'll be covering a lot of things, from how to make the most of your appointment, how doctors think, what to look for when you go into a medical appointment, how to handle medications, how to navigate a hospital, and then how to navigate end of life, advanced directives, and recognizing the limits of medicine. So this is a simplified version, believe it or not, of what we're looking at. So at the center, we have our personal health. And then surrounding that immediately are things like our genetics, our environment, our immediate surroundings, our lifestyle choices, that is what we eat, what we do, what habits we have, how we move, whether we exercise or not. And then society. That means, not only society at large, but who's around us immediately, our family, our town, our culture, all those things influence our health. And then beyond that, we have what we traditionally think of as the medical system: hospitals, clinics, healthcare workers, medications, staff within the medical system that are not necessarily medical staff. So those supporting staff in the system, and then medical insurance, and so forth. And then even outside of that, there's politics, there's financial interests, and both of those things, for better or for worse, do influence ultimately our personal health. So first things first, what is the best way to navigate the medical system? Well, I would say do what you can to minimize your need for it. That is, as much as possible, have a healthy lifestyle so you won't need the medical system as much. Now, of course, almost every one of us will eventually need the medical system in one way or another. So a bulk of this series will talk about that. But I do want to say a few things as far as how I guide my medical practice and what point of view I will have throughout this series. I guide my practice with the idea that medicine's most important tasks should be helping to prevent and also helping to detect disease and injury, helping treat these injuries and diseases when they happen, and perhaps most importantly, respecting your autonomy, patient's autonomy, people's autonomy, as much as possible throughout this process. I'll start with an overview of very common diseases that I see almost every day in my practice. These are high blood pressure, high cholesterol, obesity, diabetes, heart disease, sleep apnea, depression, anxiety. These are very common. These are oftentimes preventable. So for example, high blood pressure, only about 30% of high blood pressure cases are due to genetics. 10% are due to other medical conditions or even medications. And the rest, 60%, are preventable. Preventable by altering lifestyle choices, diet, exercise, avoiding smoking, avoiding excess alcohol, that sort of thing. So the majority of cases of high blood pressure are preventable. Another example, obesity. That has been more of an issue over the years. As an example, in 1950, only about 10 to 15% of the population in the US had obesity. And in 2022, that shot up to 40%. It's thought that a big contributor to that is the consumption of ultra-processed foods and the cheap availability of them. And then type 2 diabetes, about 75% or 3/4 of cases are preventable. Again, going back to diet, exercise, weight control. Now, why is that important? These conditions are not just numbers. When we track high blood pressure, when we track glucose numbers for diabetes, when we track cholesterol numbers, these can sometimes seem arbitrary, but they're really not. The reason why we care about them is because they connect to the things on the right: heart attacks, stroke, kidney dysfunction, vision impairment, mobility impairment, and just overall poor quality of life. That's why we care about these things. A statistic that always impresses me is that 90% of heart attacks and strokes are due to modifiable risk factors, meaning that 90% of those cases are due to things we can do something about. We can control high blood pressure, we can control cholesterol, we can control diabetes, we can control weight, treat sleep apnea, etc. These things are important to know because if we can prevent a heart attack and not have to end up in a hospital, having to get surgery, having to get stents, that's huge. That's way more valuable than having to undergo all that treatment if we can prevent it in the first place. So here's a mnemonic I use to kind of help people remember 6 things that are crucial to overall health, but this mnemonic is specific more to preventing dementia. Dementia, at least a third of dementia cases are due to preventable causes, and these are some of those causes. So this mnemonic I use to help people remember those important aspects of their lifestyle. So SHIELD. So S starts for sleep. And we all have different sleep patterns, different sleep needs, but on average, most people need anywhere between 6 to 9 hours of consistent restful sleep in order to function fully and healthfully. In recent years, research has shown that during sleep, our brains kind of do a little cleanup of kind of the waste products of cells in our brains. And without that restful sleep, those waste products hang around. And this is thought to be one of the reasons why very poor sleep can increase a lot of different conditions, medical conditions. So the next one, H, is for handle stress. So as we all know, stress can affect our health quite a bit. And reducing that stress can promote reduction of high blood pressure. It can improve mood, etc. Of course, that's more easily said than done as life happens, so stress happens. But coping with that stress, despite it happening, or things that could be stressful happening, is really the key. We can't eliminate stress, but we can learn ways to cope with it. I stands for interact, so staying socially active, staying involved in the community. That's really important when we interact with others. We use our brains much more than if we're by ourselves. We have to watch what the other person is doing, listen to them, watch what we are doing, and thinking about how they see us, thinking about what we're going to say next, how what we're going to say is going to affect us both in that moment and in society, making connections, thinking about the other person, on and on and on. These all are things that challenge our brain to form more connections and stay active. So that's really important. And then exercise. Exercise, perhaps maybe the most important of all these things. It's so valuable to health in so many ways. There's 3 main recommended forms of exercise: aerobic, strength, and flexibility or balance. Now, on average, if we can get 20 or 30 minutes a day of exercise, that's a minimum. As far as concrete ways to start this, I did bring some booklets, some handouts to illustrate how to have examples of how to actually start exercising and doing this on your own at home with minimal equipment. We don't really need to go to the gym. There's a lot of things you can do on your own with really a space, just a few square feet almost. So there's a lot of things we can do. Learning is another thing. So this kind of goes hand in hand with interaction, but the learning here points to learning new things. That is, perhaps picking up a new hobby or going into a new situation where you learn different skills, learning a new language, expanding your vocabulary in the languages you already know. The point here is to maintain mental stimulation and building new connections in your brain. And then lastly, diet. So again, another very important factor in a healthy lifestyle. Oftentimes, people have different ideas of what a healthy diet is, and there's plenty of research out there, and it can be confusing because there's so many varied takes on diet. But we do know general patterns about what a healthy diet is. For example, we know with a lot of evidence that highly processed sugars lead to greater numbers of people with high blood pressure and eventually higher number of people with diabetes, heart attacks, strokes. Same goes for diets that are high in saturated fats. And on the opposite side, people who eat more vegetables, fruit, whole grains, unprocessed foods, those people tend to have better outcomes in terms of living longer, having less chance of getting diabetes, having less chance of having high blood pressure, etc. Proper hydration is also important, goes hand in hand with diet. So as far as what is proper hydration, that may depend on your current medical state. If you have certain medical conditions, there are certain parameters for you. So you can ask your medical provider about that. But in general, getting at least 2 liters of fluid a day, that is 64 ounces. And fluid certainly includes water, but it can be other fluids, that mostly are water. So tea and that sort of thing. Fruits and vegetables have a lot of water already, so that counts in the hydration calculation. I should say I brought some pamphlets as well for diet recommendations. So this pamphlet kind of walks you through, first of all, what a healthy diet is based on research. And then it walks you through how to cook and prepare food more healthfully. And it also has some information in the back with references, a little bit of the research that was used to put together that pamphlet, and then some recipes in the back as well. So to continue talking about prevention, these are kind of the top things that I can think of based on statistics pointing to death rates in the US. So one of the top causes of death in the US is smoking still, even though smoking has gone down substantially compared to, let's say, the 1950s and 60s. There's still almost 500,000 of people who die of a smoking-related disease in the US every year. So obviously avoiding smoking is very important. Avoiding excess alcohol is another one. That leads to about 140,000 deaths a year in the US. And that may include not only liver disease, but also consequences of heavy alcohol use, such as accidents, motor vehicle accidents, falls, and so forth. What is excess alcohol? Well, that definition has actually changed over the years as we have more research pointing to what that means. It used to be that it was classified by the sexes. So if you were a man, 2 drinks a day is no more than that is the maximum. For a woman, no more than 1 drink. But more and more, that seems very high even still. So newer research points to as little as no more than 3 drinks a week being recommended. That's a tipping point for some heart diseases. For example, atrial fibrillation, which is a abnormal heart rhythm. The increased risk are about more than 3 drinks a week. So, and for a lot of people, no alcohol is better, depending if there's already liver disease, if certain medications are being taken, it may be better not to drink alcohol at all. But in general, I would say no more than 3 drinks a week, probably a good general standard. Another one is maintaining healthy weight. This is another one that people have different ideas of what a healthy weight means. But to give you some concrete data, this is a graph of a famous study where many, many studies were put together into one set of data. And this was done in 2016. It basically took 10 million people and their weights, and it classified them by weight and height to something called BMI, body mass index, the simple calculation. And it simply related over the span of 14 years how these people over that time, whether they lived or not. So if over that time, people tended to die in that period, then they were counted in this graph, basically. And on the horizontal axis, we have BMI, body mass index, the highest on the right and the lowest on the left. And on the vertical axis, we have how often people died. So as you can see, there's a clear pattern, a U-shaped curve, where the lowest incidence of death during that period was around a BMI of between 23 and 25. So this is one of the big reasons why BMI is still used, because higher BMI is correlated with higher risk of death in a certain given period of time. And the same goes for the opposite. If the BMI is too low, that also increases risk of death. So the medium, or the middle there, is where ideally one should be in terms of, at least in terms of reducing risk of death over the course of time. In this case, it was 14 years in this study. I should say that currently a normal quote unquote BMI is classified roughly between 19 and 25. As you can see, that window is a little narrower in this graph. Like I said, 23 to 25. Now, BMI is not a perfect measure. It's a rough measure. It takes height and weight into account, but there are other factors that play into this, obviously. Their waist circumference, which is a surrogate marker for how much belly fat one has. So that's being used a little bit more these days, but BMI is still valid for largely for this type of rationale. So as an example of a person who is 5'11", healthy weight is between 160 and 180 pounds. For someone who's 5'4", it will be somewhere between 130 and 145 pounds. Now, if there's someone who has a very high muscle mass, they might artificially be classified as a higher BMI, or quote unquote unhealthy BMI. But of course, as we probably know, the muscle mass, the higher the muscle mass compared to fat mass, typically that's a healthier state, because the fat mass is what typically leads to bad health outcomes. So that's another caveat, but in general, the BMI is still a good rough measure. So going back to our list, controlling blood pressure. High blood pressure is associated with 500,000 deaths in the country. Most of those are related to heart disease and strokes. So high blood pressure is a clear known risk factor for having a heart attack and having strokes. So the bulk of that 500,000 people in the US who die from that are related to cardiovascular and cerebrovascular disease. A few other things that are not discussed as much, but are very important: protecting your hearing. So a lot of older people will eventually have hearing loss, and the bulk of those people have hearing loss because of high noise exposure over the course of life. What is high noise? Well, anything at 80 decibels and above is considered high noise because it will eventually damage hearing. 80 decibels is about as loud as a vacuum cleaner. So, am I saying that you should wear hearing protection when you vacuum? Yes, that's what I'm saying. Over time, at just 80 decibels, exposure of several hours of that will lead to hearing damage. So you can imagine higher levels of that. Even being on an airplane, which is about 85 to 90 decibels, that also damages hearing. So what I do to protect my hearing is I carry around a pair of earplugs, and if I find myself in a situation where it's really loud, I just pop them in. That way, I'm prepared if unexpectedly something is louder than I wanted to. Protecting your head is another one. What I mean mostly by that is wearing a helmet if doing something riskier, whether that's riding a bike, riding a motorcycle, horseback riding, any of those things that can easily lead to falling or some sort of accident that involves hitting the head. I've certainly seen multiple cases of people who had no head protection and sustained permanent brain damage. So I can't emphasize how important that is, because there's no replacing your brain. Once it's damaged, it can make some recovery, but a lot of the damage could be permanent. And then protecting your lungs. So of course that includes smoking, avoiding smoking, but protecting your lungs also includes other things. So, if you're around smoke for other reasons, someone else is smoking, or smoke from a fire, indoor wood stoves are a big source of smoke. So of course, we have to keep warm in the winter. So if that's our only heating option, then that's what we have. However, we can install some sort of air purifier indoors and minimize the time that we open the wood stove to load it. That can help reduce the amount of smoke exposure. Air pollution, mostly in bigger cities and that sort of thing, contributes to deaths as well. So 200,000 people in the US die of a air pollution related cause. In that figure is also what I mentioned, wood smoke. More and more, we have more fires in the summer, so that also counts there. Again, minimizing time outside if possible, and installing a indoor air purifier, which, by the way, doesn't have to be very expensive. There's plenty of DIY ways to make an air purifier using just simple filters and a fan. So yeah, it just kind of takes attention to do that. And then protecting the skin from the sun, and we're talking about skin cancer. So wearing a hat, wearing long sleeves, avoiding getting burned, and even avoiding getting tanned. So tanning is actually a reaction of the skin to sun damage from ultraviolet radiation. So once the skin is tan, it actually has already been damaged. So tanning, especially if it's done on purpose, tanning beds, that sort of thing, I don't recommend that. And then avoiding sexually transmitted diseases is important. And the other two categories at the bottom, I separated a little bit just to point out that these are things that we would have to interact with the medical system in some sort, but are still important. So cancer screenings, colon cancer screenings, breast, cervical cancer. These are things that on a regular basis should be done ideally to prevent those cancers, or at least catch them early so that they don't become lethal. And then finally, getting shots that are appropriate for you. Again, this is individualized, so talking with your own medical provider is a good idea for this. As an example, the flu kills anywhere between 10,000 to 50,000 people a year in the US. That figure varies quite a bit year to year, but it can be tens of thousands of people who die from the flu. Most of these are the very old or the very young, or those who are compromised in another way, have lung conditions and so forth. So even the flu, most of us will have some sort of just cold symptoms and get over it within a week or two. but it can extend much more, and people do die from it. So getting prevention for that is also important. So I should point out that, of course, not everything is preventable. Once we're born, there are things we can't really prevent: aging, death. If we're genetically predisposed to certain conditions, certain diseases, we may have limited ability to be able to prevent those from happening. And then just bad luck, unforeseeable accidents, illnesses, things happen. Having said all that, even though not everything is preventable, even these things on this list can be made less bad with preparation, with having, as much as we can, a healthy lifestyle, with knowing, kind of thinking ahead what we're going to do if some of these things, when some of these things happen. Preparation can be really important and just make these things a little less bad. So even for that, prevention could be useful. So I'm just going to take a pause here, a breather. So I'd like to get into the overview of the medical system a little bit more as far as the nuts and bolts. So I'm going to be talking about what we call mainstream medicine. So what does that mean? Ideally, that means medicine that is guided by evidence, that is scientifically driven, based on studies that are carefully done, and importantly, repeatable, not just a one-off, but something that can be demonstrated to happen over and over again, and build our confidence that whatever the result is true. Keeping that in mind, this system is self-correcting, meaning that it changes as we get more information, get more data. What we thought was reasonably true, 10 years ago, 20 years ago, may now seem a little less true, or at least modified based on new information. This can be difficult to accept at times, because we humans like to have some sort of solid view of things, and the nature of how science works does kind of force us to realize that certain things are not black and white, and as we get more information, we know more, and sometimes we can't know. There are many things that we simply cannot know, even with science, and sometimes that's hard to realize. The other thing is that science is additive, so meaning that the information we learned yesterday will help us today, and we use that information in order to build on our future knowledge. And of course, perhaps most importantly, mainstream medicine should be guided by ethical principles, meaning we respect people's autonomy. We get consent before doing anything to someone's body, and inform them as much as possible, and let them make the decision about what they want, not us imposing something on them. And also giving them information that, as much as we can tell, is accurate. That is part of ethical principles. We give information that we are not sure is accurate, then at least saying that we're not sure is the ethical way to go on that. So that's also important. In this mainstream medicine, not necessarily a contrast, but just different to alternative medicine. Things are such as naturopathic medicine, traditional Chinese medicine, homeopathic medicine, etc. These things can also be useful, but when we talk about the medical system, the vast majority of us will have contact with what we call mainstream medicine. So that's what I'll be focusing on. So a simple way to divide the mainstream medical system is into outpatient and inpatient worlds. So outpatient refers to the clinic, refers to the emergency room, minor procedures that are done. And then the inpatient side is where a person, stays overnight, typically in a hospital setting, typically for either major illnesses or major procedures. Most interactions will be outpatient. So for people over 65, about 80% of their healthcare contact is in outpatient world. So that means in the primary care world, in specialty clinics, telemedicine will also count in this category through video and that sort of thing. I wanted to include this kind of alphabet soup of titles in terms of the possible interactions we will have within the medical system and all the people who are in it. So CNAs, for example, certified nursing assistants, a lot of them work in nursing home settings, for example, taking care of changing sheets and bedpans and helping patients move around the facility, things like that. MAs and LPNs, typically, they can work in many settings, but typically in a clinic setting, they'll be the ones who kind of first see you and take your vitals and ask you why you're here, make sure your medications are up to date, and so forth. Registered nurses have a wide variety of possibilities in terms of where they can be in the medical system, anywhere between a clinic and surgery, administration. So they have a lot of skills that are used throughout the system. And then there's two types of medical providers, the nurse practitioner and the physician assistant or physician associate. These are often referred to as APPs or advanced practice providers. Their training is a little bit different compared to medical doctors, physicians, in that it's typically a different model that they start off with. So for example, nurse practitioners start off as registered nurses and then specialize into a provider role. And in many states, these two types of practitioners have to be under supervision by a physician. Fortunately, in Wyoming, they're independent providers, so which is good in a state where we need medical providers. So, and then finally, the DO and MDs. So the training for both of these are similar: 4 years of college, 4 years of medical school, and then followed by 3 years at least of residency, which is hands-on training. The difference between a doctor of osteopathy and a doctor of medicine is nowadays really minimal. They do the same residencies. During medical school, the osteopathic track includes more musculoskeletal focused type approach. For example, they learn how to do osteopathic manipulations, which is movement and pressure and massaging of tissue under the skin to help with certain musculoskeletal conditions. But beyond that, everything else they learn, they have to pass the same exams as doctors of medicine. So for all intents and purposes, DOs and MDs do the same job when it comes to the real world. Another way to classify is the difference between primary care and specialty. So I wanted to go into this a little bit more because I think this will illuminate later talks more. So in primary care, usually that consists of family medicine, internal medicine, and pediatrics. Family medicine sees, ages 0 to death. And internal medicine sees adults, ages 18 and up, and then pediatrics, obviously only children. So primary care is ideally preventive, meaning that prevention is at the focus of practice. I'm a primary care doctor, so as you can see from my talk, I talk a lot about prevention. And it also involves a lot of coordination of care. So if someone comes to me and I can't treat whatever condition they have on my own, then referring them and coordinating that care is part of what I do. No one can do everything on their own. So at some point, all doctors and medical providers will have to refer things to someone else. And having a focus point, someone who knows you overall in terms of your medical care, is helpful to have in terms of coordinating that care and having that central point that kind of puts information together for you to bring a big picture to mind. And then, along those lines, this should be a comprehensive kind of approach. Again, kind of treating the whole person, not just treating one organ or one problem, but treating the person as a whole person and taking into account many of the different conditions going on. And then importantly, there's ideally a long-term kind of relationship with a primary care provider. In my mind, the importance of this is once I know someone, then over time I can tell, oh, this is different. Oh, we've seen this before. Let's treat this as we did before, because I remember we treated this and that helped before. And that's important because, if we have different people all the time, then it's hard to kind of keep track of everything that's going on. Of course, it's also useful sometimes to have a different opinion. So, depending on what's going on at times. And then a lot of primary care is chronic condition management. So things like diabetes, high blood pressure, depression. These are typically chronic conditions that require a long time to treat, perhaps a lifetime. So having someone who tracks this over time is important. And then in primary care, we can also treat minor acute conditions, a cold, a minor injury, that sort of thing. We can also treat that. And then in my practice, at least, I encourage people to see me at least once a year to keep up with their prevention, studies, and again, keeping track if there's medications that are going on. Oftentimes we need labs to be done once a year or more often. So keeping tabs on things is important there. And then specialties. So specialties have a different focus. They have a different approach to things a lot of the time. They're often problem focused or system focused, meaning that they concentrate on an organ. The cardiologist concentrates on the heart, and if you have a foot problem, the cardiologist won't treat you for that. He or she will only focus on the heart, of course. So the pros and cons to this, they will know a lot more about the heart, so that is very useful if you have a heart problem. But at times it might be more difficult to keep track of something else going on outside of that organ system if they're not seeing you for that. So hence the primary care side of things can help in that and coordinate that. These are usually, well, it can be either short-term or long-term, depending on the problem. So if you see a surgeon, for example, for one problem, one surgery, gallbladder problem, they take your gallbladder out, and that's that. You don't see that surgeon again after that. But it can also be longer-term problems. For example, a rheumatologist who deals with joint problems, they might see you for years and years. So that varies. Of course, as we probably all know, specialists are less accessible in rural areas with some exceptions. So that's something that we have to keep in mind. Another distinction that I'd like to make, and this will become more and more important here in Sublette County this summer with the new hospital, is the distinction between the emergency room and urgent care. So technically, currently, we don't have an emergency room per se in the technical sense. We certainly have services that give emergency room type services, that's for sure. However, as far as classification in terms of regulations and insurance, our current setup is considered a clinic. Once we have a hospital, then we'll actually have an emergency room, technically. And in either case, emergency services, I'll say that, include things that one would come to for life or limb-threatening conditions. So, anything that could result in having to be in the hospital in the short term, I would consider that an emergency condition. Things that can't wait, they can't wait another day. Those are emergency conditions. These are typically episodes, one episode focus, meaning that it's one problem typically, and that one problem is addressed that day. It's not designed, the emergency room is not designed for ongoing chronic care. For example, taking care of, long-term diabetes issues, high blood pressure, all these things. And most places are staffed by different providers from the clinic. So you will likely not see your primary care provider taking care of you in the emergency room because those are two different skill sets. The things that will be seen in an emergency room are quite different from the scenes that will be seen in a primary care clinic. So the skill set needed there is different. And oftentimes the folks that work in these two places will be different because of that. Not always, but for the most part. Urgent care is kind of a middle ground between primary care and emergency room. It treats conditions that are unlikely to need hospital care, but still need to be seen within a day or two. So a lot of times it can be hard for people to distinguish between needing urgent care or needing the emergency room. So in those cases, it's certainly a good idea to talk to a nurse who will ask questions and try to help you figure out what you need. If you need to be seen that day, and if you need to be seen in an urgent care environment versus an emergency room environment. Again, it's one episode focus, same day usually, and not designed for ongoing or chronic conditions. And again, same applies as far as not the same people staffing the urgent care are going to be the same as staffing primary care clinics, although there may be a little more overlap here than with the emergency room. So I should say that in terms of insurance, there is also a difference between how insurance sees the urgent care and the emergency room. You might notice on your insurance card, copays are different between a clinic and an ER. So that may be a difference. Of course, where you go should be determined by your medical need. But just as a side note, there is a difference in terms of how insurance sees it as well. And then the hospital. So in the hospital are usually conditions are taken care of that require closer monitoring and ongoing treatment, usually for at least a few days. Almost always, by definition, a hospital stay is an overnight stay. And even though for most people they go in with one or two main problems, in the hospital there is a little more comprehensive view of things. So for example, if you go in to a hospital for pneumonia, you'll be treated for the pneumonia with antibiotics or what have you. However, you will still get your blood pressure medication while you're in the hospital. So the doctors and providers in the hospital still have to keep in mind that you have high blood pressure and treat that while you're in there, even though that's a chronic condition. So there are different levels of hospitals. And as an example, a classification that we have is trauma level. So for example, a trauma level 1 is where is the highest level of specialized hospitals. The University of Utah is an example of that. And in order to classify as a trauma level 1 hospital, there has to be available a neurosurgeon on call and a cardiac surgeon and also dialysis. So these are very specialized kind of services. Typically these are very big hospitals that are able to provide these services. A trauma level 2, an example of that is ERMAC, or Eastern Idaho Regional Medical Center in Idaho Falls. In order to classify for that, one has to have surgeons and anesthesia and that sort of thing available 24/7. And they also must have a neurosurgeon, but they don't have to have like a cardiac surgeon or dialysis available. And then trauma level 3 is St. John's in Jackson is an example of that. For those hospitals, they have to have surgeons and anesthesia available, but they don't have to have neurosurgery available. So these are just kind of different classifications as we go along. Our new hospital will likely be classified as 4, since initially, at least, we won't have surgeons on call. So it's important to know the distinction between different hospitals, because a lot of the times your medical provider will be able to tell you and direct you in that direction. But for your own knowledge, it's good to know how specialized these different hospitals can be. Even more specialized, some hospitals just focus on psychiatric problems, for example, psychiatric hospitals, orthopedic hospitals, rehab hospitals. These are usually in big cities. And then finally, again, hospitals are staffed by different providers from the clinic and the ER, because the skill sets needed for hospital medicine, especially nowadays, are very different, more specialized. There's a lot more information one needs to know in order to provide good care in a hospital. So oftentimes there are different providers in a hospital than in a primary care clinic, for example. The exception may be some specialists. So, a cardiologist may visit patients in the hospital for a cardiac related problem and also be in the clinic at different times. So that may be the exception. Nowadays, most hospitals are staffed by what are called hospitalists. So these are typically internal medicine doctors that specialize on just inpatient medicine. They can be family medicine doctors, and those can also see children in the hospital. But oftentimes their career focus is hospital type medicine. So a little bit about procedures. So inpatient procedures are done while someone is already in the hospital, and planned major surgeries such as heart surgery, brain surgery, bowel surgery, those are also considered inpatient procedures. They usually require people to stay overnight to be monitored. And then outpatient procedures, those are things that you don't have to stay overnight for, and typically are less complex. Things more routine, like a colonoscopy. Most eye surgeries are outpatient. You can go home the same day. Elective procedures with anesthesia, without a hospital stay. Now, elective has a specific definition here. It means that it can be scheduled in advance, and it's not an emergency surgery. It doesn't mean that it's not necessary. It just means that it doesn't have to be done on an emergency basis and can be scheduled a little far out, and doesn't have to be done that same day. And then a word about academic medical centers. So I talked a little bit about the University of Utah. That is the closest academic medical center here. These are trauma level 1, which is the highest tier of hospitals. They're tertiary care centers, meaning that a lot of surrounding hospitals refer patients there if they don't have the specialized equipment or specialized providers who can provide care there. They send them to tertiary care center. Academic medical centers have a lot of different education components to it. Usually they're attached to a medical school and have a lot of medical students and medical residents and different people in training within their hospital. They also prioritize research highly, which means that a lot of the providers there are up to date with the latest research in their own special field. Oftentimes it's very specialized. So this is useful to know, because if there is a condition that is rare or requires much more knowledge, usually academic medical centers are a good place to go, because oftentimes they have the specialists who know the most, or at least are the most up to date with those medical conditions that can be more complex. So, as I said at the beginning of the presentation, next week we will talk about making the most out of your appointment, communicating with your doctor. We'll take a sneak peek at how most doctors think. I think next week's talk will be very high yield for a lot of people in terms of practical advice that you can use at your next medical appointment. So yeah, stay tuned for that next Tuesday. So here are my references. Thank you for coming. Thank you for listening.